Welcome to the Group Dentistry Now Show, the voice of the DSO industry. Kim Larson and Bill Newman talk to industry leaders about their challenges, successes, and the future of group dentistry. Visit groupdentistrynow.com for more DSO analysis, news, and events. Looking for a job or have a job to fill? Visit joindso.com. We hope you enjoy today's show.
Welcome, everyone, to the Group Dentistry Now Show. I'm Bill Newman, and as always, we appreciate you listening in, or you may be watching us on YouTube. Without a great audience like you, we wouldn't have great topics and great guests like the conversation we have lined up today. We actually are going to talk about, take our Clinician's Corner, which we typically do a couple times a month on Group Dentistry Now, and we're actually going to bring it to a podcast here. So we've got Sean Finn with us. He is a key account manager at Ivoclar, and we also have Dr. Tony Mennito. He is a private practice dentist at Expertise Dental and an adjunct faculty member at the Medical University of South Carolina in Charleston, South Carolina. So welcome both of you to the Group Dentistry Now Show. Thanks for being here today.
It's great to be here. Thanks.
A little jealous of Tony being in Charleston, South Carolina. He was saying that the weather's pretty nice today. We were talking about that before we recorded. So, Sean, why don't we start with you? Could you give the audience a little bit of your background and then your role at Ivoclar?
Yeah, so I've been in dental for the past 10 years. I have worked with a lot of group practices and DSOs to partner and really implement a lot of different strategic partnerships to help grow within the DSO space. I've been at Ivoclar for the past year, and we're looking at really expanding what we do in the group practice space and really being a strong partner with groups from any size, whether it be a 5-location group all the way up to the large groups that we work with here at Ivoclar as well. So we're really excited about participating in this podcast, and I look forward to engaging in a strong conversation about how we can partner with your group and be successful.
Thanks, Sean. And for those that don't know about Ivoclar, I mean, they're well known for clinical excellence. They have a long history in the dental industry. We're going to get into some of the products that they have, but they really, I was on the manufacturing side of the business and competed against Ivoclar, and just the breadth of products and the knowledge that the sales team has is second to none. And we're going to Sean, we'll pick your brain about that knowledge throughout this podcast. But Tony, a little bit about your background. You have a practice, Expertise Dental. Can you talk a little bit about that, and then also your role as a professor?
Yeah, so Expertise Dental is a general practice, much like the ones of the people who are joining us today. In that we do a lot of cosmetics, we do a lot of general dentistry. We try to be as efficient as we can, but also providing a phenomenal level of service to our patients. The other part of what I've done for the past couple of decades is I was a full-time faculty member at the Medical University of South Carolina. And during that time, I actually taught the course on composite and bonding materials. So during that 12-year span that I was at the university, I learned a tremendous amount about these materials, what works, what doesn't work. And also got to see a little bit of a peek behind the curtain of different manufacturers and how they approach creating these materials, and a lot of marketing involved in that. And sometimes the marketing is meant to sell products, and sometimes you're getting the straight scoop from the manufacturer. So we can talk a little bit about that as we go forward. But it's great now that I'm in a private practice setting and I'm able to really utilize these materials and see what they can do for a lot of patients. And I'm excited to talk about it with y'all today.
And at the top of the show, I mentioned this is a Clinician's Corner podcast. So this is perfect for, obviously, clinicians, but also clinical directors. And I would say bring your procurement director and anybody involved in purchasing and operations as well, because you're going to want to hear what clinicians want to use. We're going to talk about streamlining clinical processes, inventory management, improving patient outcomes. We're going to talk to Sean about how do you increase same-store sales as well. So this is not just for clinicians. This is really, we're going to talk about clinical products, but from the business side of things as well. So Dr. Mennito, we'll start with you. Obviously, we're talking about Ivoclar products here. You use the Tetric line, and how has that contributed to enhanced operational efficiency in your practice?
The Tetric line, especially, the bulk of my composite work these days is done with a material called Tetric Prime. And Tetric Prime is a hybrid composite, so much like a lot of other products that are out there on the market. But what I love about it is it has a simplified shade system. So there's a kind of a limited number of shades, but because of the aspects of the material, you're actually able to get some overlap on shades. So what I mean by that is an A2 can actually work for maybe a C2 and a D2 as well, because of the kind of the chameleon effect of that material. The other thing that I love about it is the incorporation of a couple of Denton shades. And if you've ever heard me speak on composites, you'll know that I love these Denton shades. They're composites that are a little bit more opacious, but what this allows you to do is solve some problems chair side that sometimes a normal composite can't solve because of how translucent that material is. So if you're trying to cover a dark tooth, if you're trying to fill a screw access hole of an implant crown and you don't want that metal to be showing through, just to name a couple of things. Class 4s, I love these Denton shades for as well. So there's a lot of benefits from having these Denton shades within the shade kind of profile of a material. And I love that the Tetric Prime material has a condensed number of shades. So we're not having to keep a lot of shades in inventory, but also these Denton shades that I can break out to problem solve when I need them.
And you know what? This is probably a great time to bring this up. You can see that I actually I was given an efficient aesthetics trial kit. So we'll talk about this at the end, but inside that is a lot of things. But Tetric Prime is one of the trials that or test packs that you'll get in that kit. Let's move on to next question here. We're going to talk about we're talking about operational efficiency in a group practice. You've got diverse needs, especially across multiple locations if you're a multi-site or a DSO. So how does Ivoclar's restorative systems, how do they really streamline clinical processes? I'm sure that's important with a single practice. It even becomes more important across multiple locations and multiple clinicians.
I think the way I would answer that is Ivoclar is really selling a solution. So you're getting every piece of the process all in one place. And I know from my standpoint as a clinician, I love it when, I've been doing CAD/CAM dentistry for almost 15 years. And when products come out that will sell me a kit, right? Something that I can use to be successful during the entire workflow. I love that because I don't have to think about what else I need to complete that procedure. So what I love about the efficient aesthetics is that they're giving you everything from isolation, right, with the Optragate, all the way to polishing with the OptraGloss system. So you literally have a solution for how to fix teeth, all in one place, all from the same manufacturer. So you know that these materials have been tested together. They work well together, the same chemistry. And so that from an efficiency standpoint, I love that, right? I love that. I have everything I need to solve any problem that comes through the door into the practice.
Dr. Mennito, that actually ties into something really important because you're talking about systems in essence, right? From one company. One of the big challenges especially with DSOs, again, with multiple clinicians, is the education and the training. So, Sean, maybe this is a good time to talk about that. You've got a system in place. We talked about this efficient aesthetic trial kit, but how they still need to understand how this all works and how it all works together. Talk about how they can leverage your team to do that.
Absolutely. In Ivoclar, I think one area where we really stand alone and really can compete at a high level is the support systems that we provide. And there's a number of different layers involved in this, especially when you look at a group practice and being able to support a group in all their locations. And when you look at our team, we have not only my team, the DSO team, where we're going to be working at a corporate level, really identifying the strategy and how we're going to implement and what that encompasses at a high level. And then ultimately, you look at the next layer, which is our field team, which I would put up our field team against anyone in the industry. We have almost 100 field reps or field support team at Ivoclar, and the tenure of our team is approximately 10 years, an average of 10 years of tenure within Ivoclar, which is just unmatched. In this day and age, with the turnover that exists, you just don't see that amount of expertise and tenure being at one organization for that long. And that really helps us create a competitive advantage where you get the stability and consistency and expertise of that team helping you in the day-to-day operations, which really is important when it comes to integrating these products and these workflows into the different practices. Because at the end of the day, I personally can have a great conversation at a corporate level about everything that I can do. But at the end of the day, our team is the one that has to help implement it with the group's team at the field level. And by having that level of tenure and that level of experience, it's an extension to your group. And there's not many other manufacturers that are able to have that kind of support system at your ready. And then the third aspect, which Dr. Mennito is heavily involved in, is our CE and education. So, sometimes the best avenue of integration and support is through continuing education. And that's something that we do very well. We have some of the best KOLs in the entire industry that support Ivoclar. And we can bring that to the group and help with carrying the message the group wants to bring to the practices that are within their group to their staff and clinicians and everyone involved. And then the last piece is the online resources and the things that we can do to help provide support when maybe our field team isn't immediately available or I'm not immediately available. And we have the Ivoclar Academy, which is an online resource that allows DSOs and their teams to get education online and resources online to help them when any kind of issue arises or when they're looking for more information and creating consistency across the group.
Thanks, Sean. Dr. Mennito, this question's for you. And this really lends itself, again, to a group practice or multi-site, or even, a single practice that maybe has some younger clinicians. Mm-hmm. User friendliness is key. So, how easy it is to actually use the product, to learn about the product, to get yourself onboarded quickly. So talk to us about some of the features that Ivoclar's products have, whether it's, reducing steps or just ease of use.
I will begin this because I'm an educator at heart, and by piggybacking what Sean just said about the importance of education. And, I have actually created a course really geared towards young dentists to help them to be successful with these types of materials. And so that's one of my favorite things to do, because I was a young dentist once. It was a while ago, but I was, and I remember how much I struggled with these materials. Dentistry has never been more complicated than it is today, and it's important that we get our young dentists off to a good start. But with these Ivoclar materials in particular, there's a couple aspects of a few of these materials that I really love. And once again, if you've ever heard me talk about composite, I will tell anybody who will listen that my favorite material in the world is the Power Flow flowable composite that Ivoclar makes, because it is something that helps to reduce the number of steps. And if it's used with that power fill system, and we'll probably talk about that a little bit later, it's a bulk fill material that allows you to simplify the process, placing fewer increments of the composite and still getting a good result. But what I love about it is that it cures so efficiently. And we don't talk about light curing enough, in my opinion, as educators, and the importance of it, because for all of these light curable materials that we place, whether it's a composite, a bonding agent, a dental cement, if we don't cure them adequately, our longevity for those materials is going to suffer. And so if you have a material like the Power Flow material that Ivoclar makes, that cures more easily with less light energy, it's going to add an extra layer of kind of forgiveness, because there are times when we're working in the mouth in a really tight area, right? Like a class 2, if we're doing a small slot prep interproximal restoration, where it's hard for that light to get down into that space to cure the material. So if we have a material that's a little bit more forgiving as far as light curing, that's absolutely going to benefit us and our patients. So that is my absolute favorite material. That Power Fill system of bulk fill materials is really a great way to streamline the process. And the literature is now really starting to come in now that these materials have been out for a few years now. And what they're finding is that the longevity that we get with these bulk fill materials is every bit as good as what we used to get with our more conventional techniques and products. So, as a clinician, that makes me feel good that I'm doing the right thing for my patient.
Excellent. And you mentioned Power Fill and Power Flow, and those are both actually in that Efficient Aesthetics trial kit as well. So, all right, moving on to a topic that is probably top of mind for all the DSOs out there: cost management. Right? It's always they say it's not about price. A lot of times it is. So let's talk about cost management. And I think everybody's cost conscious today. With inflation in the economy, doesn't matter if you're a DSO. If consumers are as well. So talk about Ivoclar products and how they contribute to cost effectiveness, and maybe from a perspective of inventory management.
Yeah, so I think I talked a little bit about simplifying shade selection with the composites as well. The Tetric Prime also has something called T-Shade. T-Shade is a material that is got a little bit more translucency to it. So it's kind of like that, almost one shade for a large number of restorations type of a scenario. So that can absolutely simplify that part of it. The other thing is, and I'm in a single owner practice, but inventory is only part of the process, right? It's only part of the things that we that we worry about. Excuse me. The one thing that I really like to talk about is making sure that we don't have follow-up visits after our restorative appointments that are unproductive, non-productive appointments, right? So if I see a patient and I do a quadrant of composites and that's the last bit of restorative dentistry that they need, I don't want to see that patient until their next recall visit, right? I don't want them coming back because they have sensitivity, because the occlusion is off, or anything like that, right? So what I love about this Ivoclar Efficient Aesthetics system is that, one, like I said, it gives you a solution from start to finish. But if you use them all as they're intended, you're not going to have patients coming back with post-op sensitivity, with issues because of, voids in your composite. So all these issues that we may have had in the past, utilizing these products the way that they're meant to will save you from those non-productive appointments that may become the day or the week after you finish a restorative procedure. So from my standpoint as a clinician, thinking not as much about what things cost as far as a material, or even limiting how much of it we need to stock, but more so in how can we maximize the chair time to be productive.
That leads really into the next point, which is patient satisfaction, right? They're not coming back because there's an issue. So that's an obvious benefit. Do you have any examples that you really can share, like, and maybe anything that you can think back on where patients have been, from an aesthetic standpoint, they're like, hey, this is really played out well. Tell me a little bit about any examples you have.
I mean, I have a lot of examples of, and sometimes it's the little things that patients notice. And I'm in a kind of a high-end aesthetic practice, so our patients pay attention a lot to those little things. So I will give you an example of class 4s. When people come in with fractures in their anterior teeth, and they first of all, they're freaking out because their front tooth is in half. And when you're able to restore that in a way that it's now invisible, you have, one, done that patient a great service, right? But also the confidence that patient has in you skyrockets. And you can't do that unless you know, one, the optical properties of the material and how to properly use them. And so I was talking about the dent and shade of the Tetric Prime material earlier. And that's one reason how we can help to create restorations that are invisible, particularly on class 4s. I think it's very difficult to make a class 4 that is invisible without using a more opacious dentin as part of that recipe. The other thing is, like I said, trying to just create restorations that are going to blend in with the tooth structure. And whether you're using a one shade system like the T shade, or whether you're selecting your shade from your Vita Shade Guide and using the corresponding shade, that's a big part of what our patients are looking at and how we can build confidence within our patient population. Because whether you think they care or they don't care, there's a very good chance that they're going to go home, they're going to pull their cheek out, and they're going to look at what you just did in the mirror. And if they're not happy with it, there's a good chance that you're going to hear about it. And sometimes it's the patients that we don't think care about the aesthetics who are the ones that surprise you and call you up and kind of give you a grief about that filling you just placed. So there's a lot of it within the aesthetics and being able to handle and understand the optical properties of the materials. And then the rest of it is kind of just making sure you understand how the materials work. And then, like I said, in the case of this Ivoclar system, knowing that because they were developed to work together, that they are going to work the way that they're intended.
So from a business perspective, how do you think Ivoclar's innovations really can impact the profitability of a dental practice? Because we look at, with one side, we're looking at cost, but we're also want to maximize profitability. One can be minimizing costs, the other can be being more productive, right? Being able to increase that patient satisfaction, more treatment acceptance. Dr. Mennito, can you speak to that a little bit?
Yeah, and I'd love to hear Sean's take on this as well. But for me, the bulk fill materials, now that we really have some good data showing that they work, can be a huge help in a practice that, especially one if they see a lot of kids. All right, kids are notoriously difficult to work on. That's why I don't really see many kids anymore. It took years off my life. I saw a ton of kids early in my career. But it's hard to keep them isolated. It's hard to get them to sit still in the chair. So the quicker you can do that restoration, the better off it's going to be. And quite honestly, the longer it takes, the more likely that the quality of that's going to struggle. So with the bulk fill materials, the power fill and the power flow, being able to basically restore anything in 2 increments of composite or less is a real help. And so I think from being efficient, especially like I said, in a practice that sees a lot of kids, is tremendous help. That would be my main take home as far as that goes.
And Sean,
and I
if you want
would,
to build on that, that'd be great.
yeah, and I was just going to add, such a important topic that we've in the group practice space have talked about a lot is that same store growth. And AI technologies, revenue cycle management, they get a lot of spotlight, and they deserve it. There's a lot of taking advantage of those technologies can really add some value to same store growth. But one area that I think is often overlooked is who you partner with from a material manufacturer standpoint. And Dr. Mennito's already shared a number of pearls, I feel like, in areas that your material manufacturer can have a huge impact on same store growth. Whether it's the quality and just getting having less failures and less retreatments. Dr. Mennito said less non-productive appointments. That's a stat or a data point that I don't know, I think some DSOs look at, but there's probably some that aren't looking at that data point and then determining where's the cause coming from. And using a high quality manufacturer like Ivoclar really saves you from having those non-productive appointments because you're using high quality materials. And then the other aspect of same store growth is the efficiency side of things. Working with a manufacturer that can provide workflows to help your practices be more productive. One example, which Dr. Mito has talked about, is the 3S Power Cure system. Utilizing the Ivoclar Blue Phase Power Cure, which is I would argue, one of the best curing lights in the industry, with the 3-second cure time, along with the adhesive with our Viva Pen, which is an efficient delivery system for universal adhesive. Again, 3-second curing time, along with the bulk fill and bulk flow composites. It saves your practice tons of time on a common procedure that most dentists probably say is not their favorite procedure. So why not make those procedures more efficient with high quality products? And that will increase patient satisfaction, profitability, and business performance overall. So those are how those products can all add to that key word that we've been hearing for the past year of same store growth.
And if you don't know about the Viva Pen, it's a genius packaging system that Ivoclar has come up with to help limit what I think is a big problem in practices, and that is wasted adhesive. We have these little dishes that we usually dispense our adhesive into, and you often dispense at least twice as much as you need. With the Viva Pen, you can dispense exactly what you need for any given patient, and there's literally zero waste. So you want to talk about efficient, it doesn't get any more efficient than the Viva Pen for adhesive delivery.
So we've got a lot of things going on here, right? As a clinician, you're trying to make decisions. There's the business decision. There's making the right decision for the patient, and then you're obviously trying to make sure that there's clinician satisfaction, that you're using the products that you want to use. So there's this intersection of a lot of things going on. Dr. Mennito, maybe take us through the process. Like, how do you make those decisions? Who you partner with? What products do you use? Is there an evaluation process? I'm sure you probably have taught that to some of your students as well.
Yeah, that's a really difficult thing to meld down too, because there's a lot of good materials out there. I mean, I'm not going to sit here and say that Ivoclar is the only good set of materials on the market, because it's just not the case. There's a lot of good materials out there, and so when it comes to trying to select a material, I have a little bit of an advantage because, like I said, I've done a lot of research in this area, and I understand the materials and kind of what goes into a good material and the best practices for using them. And the other thing that I would say is Ivoclar has a great track record in the industry for these materials, like one of the best track records for adhesive and composite. And that means something. You may not think about that, but it's those great materials that we have a lot of really good data from in the past that are sort of the shoulders that we're standing on for these newer materials, right? They were the kind of the basis for those. So I think it's important to look at that the historical aspect of a company and what they've been able to deliver over the years. Because you can't, if a rep comes into your office and they hand you a sample of a material, the only thing you can test is how it handles. You have no idea about things like wear resistance, what's the strength of it, how's it going to stain over time. There's no way you can test that, right? Because you're talking about something that's going to take 6 months, a year to really come to fruition, if not longer. So looking at the historical impact that any given company has had can be helpful as far as how to evaluate those materials. But handling is another thing as well. That's very important to dentists as far as composites go. So it's important that you get a chance to manipulate a material and see how it handles, which is great that Ivoclar has been so generous with the kit that they're giving out for you to basically test drive all these products. But the only thing you can test drive really is how it handles and maybe the optical properties and how it looks when you put it into a tooth. But you're not going to find out anything about the longevity. So it's really nice to be able to lean on, like I said, the history that Ivoclar has had and the great products that they've had from the past that have been the scaffolding for these newer products.
That's actually a great point. Let's build on that. This Efficient Aesthetics Trial Kit. Sean, if there's a DSO or a clinician that maybe really wants to find out more about the system that you have, is that the route to go? And how would somebody go about? Is that do they order one? And then what is there training and support that goes along with that? It's not you just get a kit and that's it. How does it work?
Yeah. So first and foremost, I would also add to, quality and efficiency. That is great, but you really, in order to maximize it, you do need to lean on the support through the education that's offered, through the 10 years average tenure of the Ivoclar field team. Those are what really allow you to maximize all of the things that Dr. Mennito just talked about. And of course, Ivoclar's history and reputation precedes itself. It is one of the best companies for these materials, but it's also one of the best companies when it comes to the internal culture and retaining employees to be those experts in the field to help support the practices. But going to your question about the Efficient Aesthetics Kit. So we will be providing a link along with this podcast where you can click through and actually request an Efficient Aesthetics Kit if you're interested. When that request is made, one of our field team members will be alerted. So they'll be able to come into your office and walk you through all the products that are within that kit, talk about the workflow, and support any questions you may have. You also, if you're a procurement manager or a DSO leader of some sort, a clinical director, then you're more than welcome to reach out to me. My information will be provided as well at the end of this podcast, and I'm more than happy to talk to you about how we can get that into your hands, or if there's any practices that you think would be very, really interested in using our Efficient Aesthetics Kit. I'm more than happy to talk to you and determine, where to send that kit.
Thanks, Sean. And one thing that you both mentioned was, the company that's behind the products. And I think last year you celebrated your 100th year, right? So 100th anniversary. So I think we're all close to 101 now. So Ivoclar has been around for quite a while, producing incredible products and continues to innovate. Before we finish things off with this podcast, Dr. Mennito, I wanted to make sure that you could share some final thoughts, and then you, Sean, and then we'll make sure we shout out email addresses. And you're right, we'll make sure there is that download link, that URL, so you can request the Efficient Aesthetic Trial Kit. So, Dr. Mennito?
Yeah, so I would say that the thing, once again, that I love about this is that it provides a solution, right? And Ivoclar has always been great about providing solutions. So we haven't even talked about isolation in the Optrogate. That is a really innovative product that really helps, you know, simplifying the isolation process, particularly if you're working premolar to premolar. So they, you know, everything that you need from isolation to polishing, like I said, and the Optrogloss polishing system is a single spiral. I love the spiral shape. They have points and cups and things like that, but the spiral for me is all I need for a composite to be really have a beautiful luster. And so providing that solution and giving you everything that you need from A to Z is what I love about it. I don't have to worry about how am I going to fill in the blanks of this workflow by buying, you know, other products or things to fill in the gaps, because I don't need it. They've got everything provided for me that I need to get through a composite restoration, and not only get through it, but get through it in a way that's going to make my patients happy and comfortable. And is going to make me happy because I take a lot of pride in the work that I do. So I really appreciate the innovation that Ivoclar has and the thought that they've put into these products and really utilizing them as a workflow. So absolutely love that. I will piggyback one other thing that Sean said about their workforce is that my local rep is a guy named Patrick Ross, and he is incredibly educated on their products, so much so that I've never had an issue where if I haven't texted him with a question about a product that I haven't been answered within 15 minutes. So they're great resources for you. I know he doesn't just do that for me, he does it for everybody. So, you know, definitely lean on your local Ivoclar rep to help once you do get this to really help understand these products and how they work.
Sean?
Yeah. And I'll just add that, you know, really the relationship between a dental group and a materials or dental restorative manufacturer, it's more than buying and selling products. If you're utilizing them right, it's a strategic partnership. And, you know, that's what Ivoclar really wants to accomplish as we continue to expand our team and grow in the DSO space. And we can, you know, we've talked a lot about efficient aesthetics, and it's such a great campaign or initiative because we do have products that have great results, great aesthetic results. It's science driven, how we create and manufacture our materials. So, you know, you're going to get good quality results. And then lastly, by utilizing these workflows and utilizing the efficient aesthetics workflow, you can streamline inventory. You can create more operational efficiency. So not only are you increasing patient satisfaction, increasing operational efficiency, but you also maximize profitability that way. So again, just to reiterate, I think, you know, as you know, groups are looking at strategically partnering, it's really important to really look at the material manufacturer you use and ask yourself whether they're providing you that quality, the efficient workflows, and the support that you need in order to effectively integrate these products and these workflows into your system.
Great conversation today. Dr. Mennito, if anyone wants to reach out to you to find out more about what you do or more about Ivoclar, how do they do so?
I think probably the simplest way is through social media, and I'm on Instagram quite a bit. My handle is Smile Professor. So you can definitely DM me on Instagram, and I get DMs every day, questions about all sorts of things, and I'm usually very good about getting back to people. So if you have any questions at all, or if you just want to see my work, I mean, I show my dentistry on there too, and there's quite a few cases where we've utilized these materials that are up on my my Instagram page. So Smile Professor, if you want to check that out, or if you have any questions.
Great, thank you, Sean. How about you? You on Instagram?
No, I'm not actually, but you can contact me. My email is sean.finn@ivoclar.com. So that's sean.finn@ivoclar.com. And, you know, that's the best way to contact me. And then I can reach out or connect with you and help support you however you might need, whether it's connecting to discuss our entire portfolio or whether it's simply, you know, working with you to get the efficient aesthetics kit that we've talked about today.
That's great. And we'll make sure that we drop all the links in the show notes. So if you want to actually order that or request that efficient aesthetic trial kit, we'll have that link in the show notes. Get the Instagram link for Dr. Tony Mennito and Sean Finn's email address. And that's it. I appreciate both your times today. It's late. I know Dr. Mennito had a full day in the office practicing. I'm sure Sean was working with a lot of DSOs. So thanks for taking the time in the evening here. And until next time, first off, we appreciate everybody also listening and taking your time to listen and watch. And until next time, I'm Bill Newman, and this is the Group Dentistry Now Show.
Choosing the right workflow solution is key to ensuring high quality and long-lasting direct restorations. Achieve a better patient experience, faster treatments, and stronger results with our state-of-the-art product portfolio, and increase the efficiency of your direct restorative workflow.
The Group Dentistry Now Show has listeners across North and South America, Europe, Asia, and Australia. If you like our show, subscribe today, and please tell your colleagues about us.